Good afternoon, everyone. First, I'd like to say that this webinar is being recorded, and we will have time after the presentation for questions. Thank you for joining us today. I am Bamidele Osamika. I'm the Regional Climate Collaborating Manager at Green Umbrella. Green Umbrella is a regional climate collaborative for Greater Cincinnati. We have been serving the region for the past 25 years as a backbone for environmental and sustainability work in the Greater Cincinnati. Over the years, we've connected hundreds of members, and including nonprofits, businesses, academic institutions, local government, as well as passionate individuals through our collective impact approach to tackling the most complex, compressing, and pressing environmental challenges our community faces. This webinar is titled Climate Change, Water Governance, Water Quality Governance, and Health Outcomes in Greater Cincinnati. This one on our webinar hopes to explore the connection between climate change, water governance, and health outcomes. Our panelists will make a brief presentation, followed by a Q&A. Then we will wrap up with next steps and some announcement. With the recent change in Green Umbrella's identity from Regional Sustainability Alliance to Regional Climate Collaborative, Green Umbrella joins more than 30 other collaborators across the country. All of them are working cross-jurisdictional climate action and giving our staffs and existing programs and a partnership that we have established over the past 25 years. Green Umbrella is now actually the largest collaborative in the country. Green Umbrella serves the 10 county regions across Southwest Ohio, Northern Kentucky, Southeast Indiana, myself and Nobi Kennedy, who is also on the call, and who is our Regional Climate Collaborative Coordinator, and Van Sullivan, our Senior Director of Programs and Climate Strategy, are the three primary staff members supporting climate health equity work. Alongside with us, we also have Mitch Sinkfor, who is a fourth-year medical student at the University of Cincinnati Medical School, and also Leah Rose, who is also an undergraduate student, medical student at the University of Cincinnati. This climate health equity webinar series is built on the recently completed report done with partnership with Scioto Analysis to highlight the findings of this report and accelerate action on key related issues. We have released a public service announcement toolkit that's connected to these topics covered in this webinar series. Please visit our website and other social media platforms to download and read the full report. These campaigns cover 11 climate health topics, one per month. In today's webinar is the ninth in the series, and this campaign provides data and shareable media materials every month. Additionally, the campaign shares actionable strategies at the individual, institutional, and system level. This month, climate campaign covers climate change, water quality, governance, and health outcomes in Greater Cincinnati. Do you know that water is the most vital part of human life, making almost 60 to 75% of human body's weight? Polluted water is a threat to community health. And do you know that Ohio River is the main source of water that serves more than 5 million people in Greater Cincinnati region? And unfortunately, it is not very clean. Then what can you do? The Ohio River has faced significant water pollution over the years. that issues related to these issues comes from the combination of industrial activities, agricultural runoff, and inadequate waste management. And what can you do? What can our institutions do? We cannot improve water quality by safeguarding against contaminants that's often found in tap water. Also, we can as well utilize water filters in our homes, and whether installed in the faucet or within the refrigerator. Boiling water is an effective method for eliminating many pathogens. Beyond these measures also, you can also maintain a clean watershed. So at this point, I'd like to introduce our guest speaker who will dissect this topic and be ready to provide an answers to a few questions. Our panelists for this month and Climate Health Equity webinar is Dr. Peggy and Berry. Peggy and Berry is a nurse and also retired nurse and also a PhD holder. She has worked as an occupational safety and health since 1990. She has been a licensed RN since 1977. Peggy earned an MSN in 2009, followed by PhD in 2015 from University of Cincinnati. An environmental activist since 2012. She founded Between the Waters, which is in 2022, to illuminate and educate water issues between the Great Lakes and the Ohio River Valley Basin. Recently, she received the Freshwater Hero Award for 2023, collaborating with other nonprofits through the tackling the A to Z impact of plastics and petrochemicals. Dr. Berry has co-produced over 30 presentations with international reach. Please join me as I welcome Dr. Peggy and Berry for her presentation. Dr. Berry, it's all yours.
Thank you very much for that introduction. Unfortunately, I let people know what my age is by saying, oh, I've been an RN since 1977. And I always say that my travel towards environmental activism only occurred because I got angry. I got angry at Representative Mike Turner for not meeting with a group on fresh water. We were talking about that in Washington, D.C. I came back and then I found out that fracking waste, or the fracking chemical that they put into the wells to get the methane out, was a trade secret. And I entered into a lawsuit to try and find out what the chemicals were that were going down into our soil to get methane out for gas and plastics. And I found out later in life, because we lost that lawsuit because it was a trade secret. But a couple of years back, we found that it was laced with PFAS and other organic compounds that do not sustain life if it gets into the water table, and they do migrate into the water table. So I guess we should start. Next slide, please. So I'm going to kind of go back and forth with health equity and climate, because I am a climate reality leader. And I've been I lectured 3 weeks ago on climate and health. And I found out that some of my slides you guys have already gone through. So next slide. When we think about climate, it is health. I mean, it affects everything. When it gets hot, it creates more problems with breathing, with respiratory, with our cardiovascular. And with a hot climate, you need good potable water. Next slide, please. So this is a wonderful slide that I pulled And does the Earth have a temperature? And yeah, you're going to get a little bit of this since I'm climate reality, but yes, it has a temperature. And as you can see, starting in the 1900s, the start of the Industrial Revolution, by 1970, we were starting to show more heat in our environment. Now, I'm not here to convince you it's all human activity. However, the Earth does have a cycle too. So it's both. It's a natural cycle, but it has been accelerated by our Industrial Revolution. Next slide. So one of the things I'm always worried about in this environment is the hot world makes working harder. And that's from being an occupational and environmental health nurse for so long. And it's a hard hat for me to take off because I'm still involved in occupational safety and health. So we look at migrant workers working in a field. There's also women working in the field, and when there is not enough water or they refuse to drink so that they can continue to work, you end up with health issues. And I can see somebody's nodding their head with that. Water is important, but so are those workers. So they need to be taken into consideration. Like there's no way a body can acclimate to a temperature of 120 degrees. There's no way. And what happens is your body goes to 104 degrees, and in a young, healthy person, they can manage that. But someone my age or someone with medications that they can't handle that hot world anymore. And we end up with heat stress, heat stroke, and other issues associated with that hotter world. Next slide, please. In addition, you were talking about the Ohio River and the quality of the water coming out of the river. Many years ago, I found a slide on the CDC that showed the incidence of cancer that went down the river, and that was people taking drinking water from the river. So although they were cleaning up some chemicals, it wasn't until 2010 that they realized that the Ohio River had PFAS floating down because of the DuPont industry that was making Teflon. If you remember, it's called C8. So what happened was DuPont was not a very good environmental player. And we ended up with this throughout the Ohio River and down the Mississippi into Cancer Alley. And they didn't know what they were looking for, so they could filter it. So anybody born in the 40s into the 50s, that's when DuPont started manufacturing PFAS and C8. Now, I know my slide talks about extreme weather with the rain, and we've had our extreme weather, and we will have some more extreme weather with the hurricane system. And I appreciated one of the hurricanes because we got a lot of rain. However, something like this is kind of like a rain bomb. And I know Cincinnati has done a very good job of taking care of some of the water that's a runoff from a rain system. There was one area in Cincinnati that it was always flooding, especially in the basement. And allegedly they took care of that. And I haven't seen it in that report, but there are ways to mitigate some of the extreme rain that will be occurring with climate change. Next slide, please. So you think a big city isn't susceptible to a flooding situation? And we also had flooding in the subways of New York City too. We also had it in Washington, D.C., where it flooded into the subway or metro. Anytime you have a rain event, you have to look at how safe your water supply is when it's coming out of the faucet, because you never know what's going to be flooding into that system or those intake valves. Next slide, please. When we think in terms of climate, you look at Katrina, and I was a Red Cross nurse at that time, and we had so many people bused from New Orleans up into the Dayton area because there just wasn't enough shelters in and around Louisiana and Mississippi, so we were taking care of them. But Katrina was a Category 3 hurricane, and Helene, when it came through, it rapidly went into a Category 4. And like I said, we had like 4 inches of rain in Dayton, Ohio, which is where I'm from. Next slide. Not to mention Milton. And a good friend of mine lost her home in Florida from Milton. And there's a good side of that. She's coming back to Ohio because she just can't stand the hurricanes anymore. Okay, next slide. Now, the Earth has this very thin layer of oxygen, and it's called the stratosphere. If you took a plane straight up in 14 miles, you'd be in outer space. Now, all of that, all of climate change, everything is predicated on the fact that nothing escapes into space with that. So any carbon, any methane, which are 2 powerful climate change chemicals, are all in that climate, all in that stratosphere, and is causing our issues with climate. Next slide. So when I always think about climate disasters, it's a chemical disaster and a water disaster. When Helene came through and Asheville, North Carolina had flooding, and North Carolina, there's still areas that they don't want you to visit in because they're still having problems recovering from the hurricane. Some of the workers complained that the boots that they were wearing, you know how you have your fishing boots that go up to the hip, your hip boots, they were melting because there was some kind of chemical in that flood water. And when you think about it, all of this is going to like whoosh down into the rivers where we get our drinking water from. Maybe not necessarily North Carolina, but it does make it into water systems that are accessed for water. So again, when you have a climate disaster, it's a chemical disaster because it turns into a water disaster also. It's so combined. When I was floating down the Mississippi, I took this picture of a chemical plant. And I also know in Kentucky, they have open slurries for coal mines. They have some of the fracking solution in the injection wells. Before it's in injection wells, it also is in a pond. So when we have a inclement rain that floods those ponds, that water goes into our Ohio River, which is why the water quality is not that good. And they have to really work hard to get the water to a drinkable state. Next slide, please. So I know I want to talk a little bit about water equity and who's affected. And when we look at the BIPOC population, Black, Indigenous, and community of color, you're also looking at low-income communities also, because it seems like they are the last ones to have the lead pipes removed. And they're in the older houses that still have lead pipes that go into the house. So even though they may have gotten the lead pipes removed on the street, there are still the lead pipes going into the houses. So they can't change those. And the older houses are like that. Next slide, please. So water governance is also important because it helps with sustainability, it avoids disputes, and water security. However, when you think about it, even Mexico has a problem with the United States cordoning off the Rio Grande so that they don't have access to that water. So it's not only a state issue, but it can become an international issue. And as we become more a desert because of climate change, water is going to play a significant issue in the future. And we already have some of these water wars going on in the West. California, Arizona, New Mexico, all of it is how do we supply the population with water? So water governance allegedly helps delay those conflicts. Next slide, please. But still, even with water governance, this is a great slide I pulled, we still have the BIPOC community and low-income community having their waters turned off. And during COVID, Governor DeWine tried to stop that. But even so, when we look at it, they, in the United States, Black households accounted for about 1/3 of the utility disconnects, which was water also, even though they represented 1/6 of the households. And they said that if 10 to 15% of water customers have at one point had their water turned off. So will this emerging assembly of climate gaining actions and actors help with that? I tend to think water is a service and not a commodity, but we have made it a commodity. I mean, what did we do in the 50s prior to plastic water bottles being carried around all over and being sold? When somebody traveled, they took a thermos full of water. That's what they did. So now we have Nestle going after any kind of water system they can to fill up their plastic water bottles, which is not a good thing. So with water governance, I would say it's a great slide, but if we have an incapacity for a central entity, I believe it needs to be a public service and not a private service managing our water system. A place in, I think it was in Virginia, went from a public water system utility to a private water facility, and they found that their rates went up substantially. So, when we look at public actions, we have to look at groundwater extraction, desalinization. Desalinization is on both the coasts, even though we're not aware of it, especially in California, to get as much good water as they can with the desalinization process. And then, of course, there has to be a disaster plan for distributing water. And if you recall in Toledo, they had to shut off the intake because of algae blooms. And according to my sources, they had a very hard time disseminating the fact that the water was tainted with algae and could cause sickness. So there has to be a centralized grid in order for people to be aware of the issues happening with water. One of the other things, especially groundwater extraction, Nestle did an excellent job of going into Michigan and Minnesota and accessing the water for bottling. That's something that we as a group need to work harder to make sure that we stop water bottling and move to a more sustainable source. Okay, I'm just going to say next slide. Feel free to look at this as much as you want. Now, the other issue, waters are right. So when you turn it off during pandemic, you are creating more problems than it's worth for the BIPOC population. They allegedly stopped that. And then as the pandemic waned within a year or two, they have started to turn water off again. And this is, again, an issue for BIPOC population, but also low-income whites. The other side of it is selling waters to bottle, which I've already talked about, and the pollution that occurs with fracking. And that's probably the thing that I fight the most is pollution that occurs from fracking, which is hydraulic fracturing of the ground to get the methane out of the shale. And we have shown, matter of fact, a place in Pennsylvania, Dencock, Pennsylvania, can no longer drink the water from their wells because it's contaminated with fracking. And they've had to put in a whole new water system, but they still can't use that water, nor can they bathe in it because of the poison from the fracking solution that's been put into the system. And I'm going to say, besides water is life, water is also a right. And I don't think we should ever take that right away for non-payment. And there has to be a way, some way in the future that water is provided to everybody at a minimum rate so that, or free. I'm sorry, maybe I'm a socialist, but I think it ought to be provided for free, and it should be clean, and it should be free of PFAS or the C8. 20% of the water systems are still affected by PFAS. So there is a lot of work that we need to do going forward so that we have fresh, potable water that isn't somehow tainted by PFAS or a new chemical that has been created allegedly to make our lives better, but it ends up polluting us. And 98% of the people of the world are now contaminated with PFAS. And I don't see this getting better. I can see it getting worse because there was another study that I read that the fish taken out of the rivers in Illinois all were contaminated with PFAS. The deer have some chemical PFAS. And as we eat meat and our beef is contaminated with PFAS, that continues to build in our systems. Next slide, please. So what can we do? We need to build public support for our water. It has to be community-driven regional water partnerships. And because of climate, we need a call for climate mitigation in the water sector. We need to take all of that into consideration with climate change because we are going to see more, what is a good way of putting this? We are going to see an influx of more people from the coastal regions moving into the interior of the United States. We will all be affected by climate and by inclement weather that will put a strain on our water system. And therefore, we need to reach out to one another and make sure that we keep water as a public utility and support water for all and no turnoffs. Next slide, please. So if you want references or you want more information, You can call me or you can email me at the above or the email and the phone number there. And I'm sure they will get copies of the slides if they want it. Okay.
So,
Then that is all that I have for you. Do you have any questions?
thank you, Dr. Berry. I really appreciate those information. Very helpful and to us all. So this time we want to start the Q&A session. So we have still have like a couple of minutes on call. We want anyone that have any question to drop their question on the chat room, or you can just jump off the you unmute yourself and ask this question if you're comfortable with it. So, but before we kind of start, we've not seen any question from the chat. We want to start with the few ones I have here, like one or two questions to kickstart. So, Dr. Berry, want to ask, first question is, how can water quality monitoring be improved in areas with limited resources?
Ooh, good question. In my humble opinion, all right, we look at the monies from our federal government and the EPA, and every day I get 2 or 3 messages from the EPA on the infrastructure bill dissemination of funds. I think that in terms of improving water quality, now I also know that there are intakes all along the Ohio River, and they do testing all along the Ohio River. However, it should be equally applied so that they all have fresh water. But, the one thing that I always like to say this, Dayton has a great quality water, public water utility, and they've won awards. However, they have to go through the pipes to get to everybody's household. And that is why it is essential that all the lead pipes be replaced, not only street level, but into the house. And the infrastructure bill pays for all of that instead of making households pay for it also. All right. So I know I'm kind of going around with this, but how can we? And that is to apply it equally throughout this nation. They should all test for the great water for great water coming out of the Ohio River.
Thank you.
Okay.
Yeah. Thank you. So I have this another question is what roles do institutions or government play in mitigating the impact of climate change on our water quality, especially for vulnerable population?
Let me repeat that. I'm sorry, repeat that, please. It seems like it's...
Yeah, what roles what can institutions do to mitigate the impact of climate change on water?
Well, first, the politicians have to recognize that there's climate change. Okay, don't do the opinion, do the science. Just like I showed that slide, the temperatures increase. They need to keep their act together and work with the public and educate the public, as well as create a better governance for the water that they do have. And they have to take into consideration that there is climate change and it does impact our water. And, it's kind of weird, you go water everywhere and not a drop to drink. So they need to keep our water systems safe. Now, I know Cincinnati draws it from the Ohio River. They don't have aquifers like we have in Dayton, but even the aquifers can be made unusable because of volatile organic compounds making it into the system. They've even had to move their intake wells out of the aquifer to another area because there was this big spill of a volatile organic compound in North Dayton. So they need to keep they need to keep monitoring water quality. They need to work at filtering the system to meet the needs of the population. And they need to acknowledge that climate change will impact our water quality, whether by having too much rain or by not having enough. And some of the areas of Ohio and Pennsylvania and West Virginia are in drought level right now.
Great, thank you.
I hope I'm answering the questions for you fairly decently. Some of it is just my opinion, in my humble opinion. You know, I don't think anybody should have their water turned off. I don't think anybody should have their electricity or their gas turned off, especially in the middle of winter. They may not have a place to go. So and this is all related to climate too. We're going to have we will have some warm winters, and then we will have 14 feet of snow. We end up with a rain system like Hurricane Helene meets a nor'easter. There will be just snow. And Boston had that for a couple of years. So, okay.
Cool.
Any other questions?
Yeah, I think the last one I have here is what's the best practices for us to engage with vulnerable populations on water governance, especially the BIPOC, the low-income communities? How can we best engage them in water governance to enhance their health?
Okay. So I'm gonna go back to my my research when I was doing my PhD, and one of my professors was going, you know, when we did this survey on workplace violence, it appeared that workplace violence increased in the hospitals while we were doing the survey. And I looked at her and I said, well, it's because you're actually listening to the nurses, and they think that somebody's actually listening and noting the violence that has occurred to them. And before, they didn't report it because they didn't think anybody cared. So what I think, every BIPOC community and low-income community, they need to be engaged by outreach and community outreach. And with that, you need to find your trusted sources in that community to help you reach out to get their ideas on what water governance should be.
Thank you. Thank you very much. We really appreciate those answers. And I hope that the attendees were kind of very appreciate this. I have not seen any question from the chat, so I think we have to move forward now. And we have a few minutes on call today. So next slide. I think moving forward, what can you do to enhance to adopt more resilient strategy to improve water quality? One, as individual, you can utilize water filters in your homes, and boiling your waters could also be another helpful ways to improve your drinking water. Volunteer to participate, as Dr. Berry said, like outreach. So please volunteer to participate in water governance, and also like cleaning of watersheds is also part of those volunteerism you can do as individual to improve your water quality. Also talk to your elected officials to support policies to improve water infrastructures. As Dr. Berry said, it's part of our presentation. So please get engaged, involved in this water and quality governance issues so that we can build more resilient community. Also, as institutions, we also ensure that our governments should better manage agricultural and industrial waste. And the PFAS, all those pollutions come from, pollutants come from this agricultural, mostly come from this agricultural and the industrial waste. So we want our government to kind of better manage these wastes. Funding and implementation of water pollution control programs, and invest in sewage, water, wastewater infrastructure, support research and technology to improve water quality. In addition, we have few announcements to make. Next slide, please. So we have November, which is next week, we have our urban food system resources sharing session, which is going to be between 3 to 4:30. It's virtual. Please log in, check our website to sign up for this, to participate. We also have our next climate health equity webinar next week because of and holidays, so we have to move this earlier to the month. So it's going to focus on food access, which is still the same time, noon, by next week, Wednesday. Yes, yeah, next week, November 6th. So we also have November 8th, we have Green Space hiking series, which is basically going to be at the Bender Mountain and Autumn hike between 3 to 4:30. Clean energy funding opportunity webinar, we also have that November 14th, and on December 10th we have Green Umbrella annual meetings and celebration, which is between 5 and 8 p.m. Please endeavor to join us, sign up, and join us in these activities, and also visit Green Umbrella online platform to get engaged. And we hope that as you get engaged in these activities, we help to build more resilient system and community. Next slide. So please, thank you for joining us today. We hope that you're going to join us in our subsequent series. And we have like a survey to kind of hear your feedback on the call today. You can as well fill it on your own at your own leisure time. We're going to follow up also with an email and also the slide deck. So thank you for joining us today, and see you next week, Wednesday. Bye for now.